Cambridgeshire Community Services NHS Trust is proud to be improving the lives of children, young people and families by transforming the Healthy Child Programme across Norfolk and further afield in Cambridgeshire and Luton. This film summarises some of the fantastic improvements our staff have introduced during our first year as a provider of these services in Norfolk through introducing equitable and integrated services for 0 to 19-year-olds. I'm very proud of the difference our staff are making throughout the county, and I'm confident their positive impact will grow as we implement our ambitious plans for the future.
As a result of our redesign programmes, a range of new roles have been introduced, including a county-wide clinical lead, professional leads, specialist practitioners and safeguarding lead nurses, all of which have resulted in additional capacity and expertise which are providing significant benefits for families. In addition to the developments highlighted in this film, with 6 pilot sites delivering a new integrated 2.5-year review which will be rolled out across Norfolk in the coming months. And we've introduced a new service model to provide integrated weight management, vision and hearing screening services. The introduction of mobile working is supporting our staff to maximise the amount of time they spend with families, and the imminent launch of a single point of access, just one number, 0300 300 0123, will streamline and improve access to all our Healthy Child Programme services.
Working with our staff, families, Norfolk County Council, GPs and other partners, we are making a real improvements to services across Norfolk. Our programme of needs profiling and school profiling will continue to ensure we focus on prevention and early intervention. We hope you enjoy this short film which highlights just some of our achievements, and that you join me in commending our staff from the Healthy Child Programme for their outstanding commitment over the last 12 months. There is more we can achieve, and we look forward to continuing to work with you to take forward our ambitious programme to improve the health and well-being of children and young people across the whole of Norfolk and give them the very best start in life.
Every child deserves the best possible start in life. That's why our 0 to 19 services are engaging with every family across Norfolk to improve outcomes and reduce health inequalities. Since January 2016, we have successfully redesigned our 0 to 19 services, introducing 6 integrated locality teams which are aligned with early help districts to identify and support families at an early stage. Together with midwives from the acute hospitals, we have developed the antenatal pathway, and we are delivering Pathway to Parenting courses with children's centres and midwives across the county.
Well, Early Days fundamentally is a group we run for babies from 0 to 3 months and their parents.
It's promoting the parent-infant relationship, so we work alongside the health visiting team, promoting that early attachment.
Sometimes in the very, very early days, parents do struggle understanding what their babies are trying to tell them. And in this group, it's a really safe, nurturing environment to have those discussions with them.
The service has benefited me a lot. It's been good to meet people who are in a similar situation to me.
As a health visitor, my main role is promoting good health and preventing ill health within a community, and hopefully giving children and families the knowledge to make healthy choices.
Yeah, so we think the health visiting service we get is brilliant. It's more than what we could ask for. Just makes it easy for us. And,
yeah, it's lovely knowing we've got her coming over and we can talk to her about anything.
Children's long-term success is shaped by whether they have the personal, social and emotional skills needed to benefit from the opportunities available at school. Across Norfolk, we know that there is a variability in children being assessed as school ready. We are delighted, therefore, to have worked with IC&I Healthcare Limited to develop and train practice nurses to deliver a 3.5-year school readiness check.
Hi, I'm Ruth Loads. I'm one of the practice nurses that work at Baker Medical Practice, and I've been involved with the 3.5-year school readiness check since summer of 2016. It's basically a way of meeting the parents and the children to discuss any concerns they may have. It's enhancing the skills that they already have, but enabling them to get the best out of their early school years. It's a way of looking at diet, hearing, vision, toileting, ability to mix with others, ability to get involved with reading, all those types of things to enable them to get the best out of their early school years. We've had good feedback and it seems to be working very well. It's not an additional appointment because we do it at the same time as their preschool booster.
It was very informative, and it's good to know that if I have any concerns, there's someone to talk to.
You only have to ask anybody in this building. I come to work because I love it, and this is not work. I do this, and I have been doing it for the last 35 years because I love it.
We are engaging with schools, young people and our commissioners to redesign our services for the 5 to 19 age group. Our Chat Health confidential text messaging service is successfully providing an alternative way for young people aged 11 to 19 to engage confidentially with school nurses, and we have received over 3,000 texts in its first year.
So recently we've got Chat Health set up, and Chat Health allows high school children where they can text in and they can be anonymous conversations. They are confidential conversations, but that can be anything for a range of relationship advice, healthy eating, smoking advice, or bullying or exam stress as well. We've had a really positive response actually from the young people that use Chat Health. They really like that they can text in at any time. So for me it was really wanting to get out there, get into the setting of where young people are and really see what we could do as professionals, as nurses, to help them manage those really difficult situations in their life and really empower them to take control.
My sister was involved in an accident and I just wanted someone to talk to that I felt comfortable with, and they didn't know me as such. I just wanted someone to talk to. It was really helpful to me. It kind of helped me recover and say everything that I wanted to say that maybe I felt like I couldn't to someone that knew me or my sister.
I would provide people with a business card which had the number of the Chat Health nurse on, so they could contact their number. If needed, then I would 100% recommend the system to anyone in it.
I haven't had any personal use with it, but I know someone who has, and he found it really helpful. It really helped him.
There's a need for school nurses to be accessible to young people, and I think that for me I like to come to work to know that I can try and make a difference to even if it's one young person, and I think that by promoting Chat Health and school nursing out there is that we are accessible, we are there, it's free, it's confidential, and that everybody should be able to have somebody to talk to.
Over the last 12 months, the Norfolk Family Nurse Partnership Programme has successfully supported first-time young parents. At any one time, each of our 8 experienced FNP nurses have supported up to 25 families to promote behaviour change, build healthy relationships with others, provide sensitive and responsive caregiving to their babies and children, and find additional support networks within their local communities. During 2017, we will be introducing a new service for all teenage parents across the county, incorporating and bringing together the learning and positive outcomes from the Family Nurse Partnership. Our team is passionate about making a difference to the lives of these young parents and children, recognising that the earlier in pregnancy we can start to work with them, the better the outcomes will be. We are confident that our new locality-based model will support young parents develop into confident, caring and resourceful young parents able to give their children the best start in life.
I love working with the teenage parents. I love that we start in pregnancy. It's a real opportunity to build a relationship with them. Often these teenage parents have had real challenges in their lives. So by talking about these things with them in pregnancy, we can start to build on the strengths, we can start to really understand how they feel about their lives, help them to achieve their goals, and we start to see changes. And if I thought I've had some kind of positive influence on somebody's life and to benefit and make that a better life for them, well, that's the greatest reward for me.
We do activities with Ella, and say we knew quite a bit already, but we thought we did, but we've still learnt a lot.
Yeah.
And different sort of tasks and routines we can do with her, and
they're not just there for the kids, are they? They're there for you as well, which is nice.
No, family nursing they helped us out a lot. I mean, you know, just with the little things like the information support and the help that they can give us with Ella.
The family nurse partnership has been brilliant, so thank you.
Children and young people with additional needs and disability are particularly at risk of poor outcomes if they don't receive timely and responsive services. This year we've been involved in a project to identify children with additional needs and disability in each locality and promote the offer of an annual contact to themselves, to young people and their families.
Families have told us that the tool we currently use to review development of children with additional needs and disabilities is inappropriate. We have listened and we are now looking to roll out a schedule of growing skills across the county for practitioners to use as an alternative tool.
We've delivered 10 training workshops, particularly so that staff are aware of their responsibilities in ensuring that these children are identified within a caseload and that they're having their needs met. Staff are now increasingly aware of their statutory responsibilities and are going to be involved in initiating education, health and care plans at an earlier stage.
Families accessing specialist provision have told us they are having to travel many miles across the county to be able to access these. As part of our project, we have looked at where these services are and how we can replicate good practice to support the needs in each locality. This has included preschool groups and nurture groups for premature babies.
So that's a summary of some of the projects we've been involved in this year. But here are some of the views of our families. They wish to share their experiences of our service and their hopes for the future. We have a passion for working with children and young people with additional needs and know we can make a difference.
Yeah.
Most children become looked after as a result of abuse and neglect. Although they have many of the same health issues as their peers, the extent of these is often greater because of their past experiences. Delays in identifying and meeting these children's health and emotional well-being needs can have far-reaching effects on all aspects of their lives, including reaching their full potential and leading happy and healthy lives as adults. We have a team of 13 health visitors who are passionate about providing timely, good quality health assessments for looked after children under the age of 5. Additional training provided this year in partnership with the Norfolk designated safeguarding team has supported the health visitors' development and skills. There has been an improvement from 20% to 100% of assessments being undertaken in a timely way, with identified actions fully completed. Quarterly audits have also highlighted that the assessments are age appropriate and capture all of the child's physical, behavioural and emotional development needs, utilising information from health professionals, parents and the children themselves. The positive feedback we're receiving and knowing that we are making a real difference to these children's lives is really rewarding, and we cannot commend highly enough the skills and commitment of our looked after child health visitors.
There was one young baby who had been removed at birth and he had loads of health problems, absolutely loads of health problems, and we worked together with the foster carer and other health professionals, and he ended up being successfully adopted. And he was thriving. He was doing really well when he moved on to his permanent home, which was a really nice, positive story.
I'm hoping to really be able to make a big difference in children's lives and in families' lives. I've dealt with a family where the little girl is a foster child, and I've been able to maintain that continuity, visiting the family regularly, ensuring that the little girl is getting all the help and health needs that she requires, being able to pinpoint and signpost the family to different services that are available to them in the area.
I've already been back for a second time to some of the children and we're seeing a huge difference. Assessments are being followed up, the care plans that we put in place are being followed through.
I have noticed a definite improvement in the health visiting team for looked after children over the past year. It's really helpful because the children have lots of professionals in and out of their lives and it can be quite distressing for them. And having that knowledge of the whole system and the process is really helpful, especially when the health officers can come to looked after reviews and have their input. And it's definitely a big improvement.
Absolutely love my job. Love every part of my job. I love working with families. I love providing a service that I can be proud of.
I come to work because I want to make a difference for these children. It's really important to me. Really, I think all of us who do the looked after children work are really passionate about it, and we can see the importance of moving this forward and making sure that they get the best outcomes.
Safeguarding children and young people and protecting them from harm is everyone's responsibility and one of our highest priorities. Our skilled practitioners who deliver the Healthy Child Programme across Norfolk have worked hard with partner agencies using multi-agency safeguarding procedures to identify signs of abuse and neglect at an early stage so that plans can be put in place speedily to protect children who are at risk of harm. To support our frontline practitioners to better protect and safeguard children, a step change in the way the Norfolk Healthy Child Programme safeguarding service works was introduced. Our team of dedicated safeguarding lead nurses who are aligned to each of our 6 localities are providing accessible expert advice, support and supervision to ensure practitioners can take effective action to safeguard the children and young people in their care. We have every intention of continuing to deliver high quality safeguarding services to promote the welfare of Norfolk's children and to support them to achieve their potential.
Co-producing our services with parents, young people and children is the golden thread that runs through everything we do. We have appointed a co-production lead recently who will work with our clinicians and families to continue to develop services which are responsive and accessible. We have achieved much in the past year and are looking forward to achieving our ambitious objectives for the future.